This is Counsel Club, and I'm Dr. Ina, and we are talking the difference between a life coach and a therapist. So when we're faced with life challenges, sometimes we need a little bit of guidance to help us navigate through them. That's where life coaches and therapists come in. Whether you're looking to achieve specific life goals, improve your performance, or address deeper emotional and psychological issues, understanding the differences between a life coach and a therapist is crucial. But what is the difference between a life coach and a therapist? How do you know which one is right for you? In this video, I'm going to break down the key distinctions between these two professionals so you can make an informed decision about which path to take. We'll cover their goals and focus, education requirements, and the methods and approaches they use, as well as the types of situations where each one might be the most helpful. A life coach and a clinical therapist both aim to help individuals improve their lives, but they do it in different ways and with different approaches and with different qualifications. So let's start with life coaches. A life coach is a professional who helps clients identify and achieve personal and professional goals. They focus on the present and the future. They provide guidance and support to help people reach their full potential. So the qualifications to become a life coaching typically does not require any type of formal education in psychology or mental health. A life coach may get a certification from a coaching program, but the life coaching industry is less regulated than the clinical therapy industry. The approach that life coaches use are typically techniques like goal setting, motivational interviewing, and action planning. They help clients identify their strengths, set goals, and then develop strategies to achieve them. So an example might be if someone is stuck in their career and they want to advance, but they don't know how to proceed. A life coach can work with that person to identify their goals, such as getting a promotion or changing fields. Then they're going to help them develop a clear action plan. It's going to have steps like enhancing skills, networking, applying for a new position. The life coach is going to provide ongoing support, motivation, accountability as their client works towards their goals. Now, a clinical therapist would handle that situation differently. So by definition, a clinical therapist is a licensed mental health professional who is trained to diagnose and treat emotional, behavioral, and mental disorders. They're going to typically use evidence-based practices to help people address psychological issues and improve their mental health. The qualifications for a clinical therapist, so they're typically going to hold an advanced degree, a master's degree or a doctorate degree in psychology, counseling, social work, or a related field. They are licensed by state regulatory boards and they have to adhere to professional and ethical standards. The approach of a clinical therapist is going to be different than a life coach. Therapists use techniques like cognitive behavioral therapy, psychodynamic therapy, humanistic therapy. They focus on exploring the past and present issues to help clients understand and change these problematic patterns of behavior. So an example of what a clinical therapist might do would be if someone is experiencing severe anxiety, right? It's interfering with their daily life, their work, their personal relationships. The clinical therapist is going to work with that person to help them understand the underlying cause of his or her anxiety. Through techniques like CBT or other evidence-based approaches, the therapist is going to help their client identify and challenge negative thought patterns, develop coping strategies, and gradually reduce anxiety symptoms. The therapist is going to provide a safe and supportive environment for the person to explore their feelings and work through their issues, both past and present. So some key differences between a life coach and a therapist. One is going to be the focus and goals. A life coach is going to emphasize goal achievement, personal development, and future-oriented planning. A clinical therapist is going to address mental health issues, emotional well-being, and explore past and present experiences. They take different approaches to do this. A life coach is going to use coaching techniques, motivational strategies, and action plans. A clinical therapist is going to use therapeutic methods based on psychological theory and evidence-based practices. And lastly, the qualifications. A life coach, you can get qualified through a certification program, and it's less formal. Whereas a clinical therapist, like I said before, is typically going to require an advanced degree, licensure, and rigorous training in mental health. When it comes to regulation, life coaching is a less regulated field, so the standards are going to vary across different certification programs, whereas clinical therapy is a highly regulated field with strict licensure requirements and ethical guidelines. So deciding whether to seek a life coach or a therapist really depends on your specific needs, goals, and the nature of the challenges you're facing. So here's some questions to ask yourself to help you determine what type of professional might be best suited for you. First, ask yourself, what are my primary goals? If your goals are related to personal development, achieving a specific life or career objective, improving performance, or gaining clarity about life in general, a life coach might be more appropriate for you. But if you're dealing with emotional, behavioral, or mental health issues like depression, anxiety, trauma, or relationship problems, a therapist might be a better choice. Then ask yourself, am I experiencing symptoms that are affecting my daily functioning? If you're generally functioning well, but you just need some guidance, motivation, and maybe even support to achieve your goals, a life coach might be the way to go. But if you are struggling with symptoms that interfere with your ability to function, like chronic sadness, panic attacks, overwhelming stress, or substance abuse, then a therapist might be a better option. Ask yourself this: do I have past traumas or experiences that need to be explored in depth? If your primary focus is the present and the future, and you're not really looking to delve too deeply into the past, a life coach might be the path for you. But if you need to address and process past trauma, unresolved issues, or emotional pain that affects your mental health, a therapist might be the way to go. Then ask yourself, what kind of support am I looking for? If you're looking for someone to help you set and achieve goals, provide accountability, offer strategies for personal and professional growth, a life coach might be the one for you. But if you need someone to help you understand and manage your emotions, change unhealthy patterns, develop coping mechanisms for mental health issues, a therapist might be a better choice for you. Do you need a structured treatment plan for a mental health condition? If you're not in need of like a formal diagnosis or a treatment plan for a mental health disorder, but you just want guidance and support for a specific area of improvement, a life coach might be a good choice. But if you need treatment, diagnosis, medication, evidence-based interventions to address a mental health condition, a therapist might be a better choice. Then you want to think about, what kind of professional qualifications and experiences do I prefer? If you prefer to work with someone who is trained in coaching techniques, focuses on motivation and goal setting, go the life coach route. But if you prefer to work with a licensed mental health professional with advanced training in psychology, counseling, or social work, then you might want to seek out a therapist. Some other things to consider are the possibility of the combination approach. Sometimes individuals can benefit from having both a life coach and a therapist that are addressing different aspects of their needs at the same time. For example, you might work with a therapist to manage anxiety, but you might also be working with a life coach to achieve career goals. By taking the time to do your research and reflect on these questions and really consider what it is that you specifically need, you're going to be able to make a more informed decision about whether or not you need a life coach or a therapist. Remember, taking the initiative to seek help is a positive step. It's going to improve your well-being, and finding the right type of support is going to make a significant difference in you achieving your goals and enhancing your mental health.